Hi everyone, my name is Clairerista Cenerini, and this is my MSW Capstone presentation. I'm a 26-year-old white cisgender female presenting to you today on Treaty 1 territory. The remainder of my introduction, aside from my social location, will be integrated into the creative component of my capstone project.
First, I'll talk about the source of my inspiration. Brandon Regional Health Center is where I completed my MSW practicum, primarily in the emergency department. This is where I experienced my first palliative care admission that left an unexpected, meaningful impact. With little experience with death, personally and professionally, I dove headfirst with my supervisor to provide care to our 83-year-old patient who attended ER unexpectedly. He and his family certainly did not anticipate that day would result in an admission to palliative care. Our patient had a known slow bleed in his abdomen that was starting to speed up, increasing risk of rupture. With some complex health considerations and assessment work, involving repetition and the perspective of his adult son, we were able to support our patient in understanding his options so he could exercise self-determination and make an informed decision. Our patient ended up having to decide between taking an ambulance to Winnipeg for surgery, which is a 2-hour drive posing a high risk of dying en route without family around, or a palliative care admission, which he ultimately chose. We were able to advocate in bending the policies related to COVID-19 restrictions so that our patient could safely have 2 other close family members visit together following his transition to palliative care. With no prior exposure to palliative care and the gentle, sweet nature of this patient, it's a case that will always stick with me for reasons beyond this kind gentleman's demeanor, which I'll explore in more detail after explaining my creative project component. Here we have a young tree that will be planted throughout my presentation. So, why a tree? My palliative care patient died days after his admission with his son by his side, and there was an option to donate to plant trees in his memory. At the time, I chose to send a sympathy card, so I took the opportunity to revisit planting my own tree in his memory, using its significance and symbolism to connect to my other learning throughout my life and the MSW program. The roots represent my childhood and why I wanted to go into social work. Being born with 2 young parents facing collective struggles with addiction, mental health, uncontrolled anger, and criminal involvement led to contact with the child welfare system early in life. As a 2-month-old baby, I entered foster care and eventually became a Crown ward. My paternal grandparents adopted me, which was all finalized just after the age of 2. These decisions were made in my best interests. Having this experience as part of my early life was my primary motivator to study social work. Originally, to better understand the work involved in life-altering decisions to keep children safe and giving back to a system that completely altered my course in life. This small trunk represents the core of my professional experiences and points of growth. I completed my BSW at Carleton University in Ottawa. I've been employed at 2 child welfare agencies in different provinces with different roles. Prior to starting the MSW program, I moved into a case manager position with Veterans Affairs Canada. With my husband being an active regular force member in the military, my current place of employment is also driven by intrinsic motivation to support the military and veteran community. My most recent contribution to the trunk of this tree is my MSW practicum at the hospital, which, as mentioned, was primarily in the emergency department. But I also had the opportunity to work in other departments such as maternity, surgical, renal, rehab, and recovery while my supervisor was on leave. This brings us to the branches and leaves. The branches represent the social work competencies, which will connect to the plentiful leaves that symbolize my many practicum experiences, which is what I'll focus on next as I plant my tree. I never anticipated wearing my farm shoes and rain jacket during such an important presentation, but as social workers, we adapt to our environment and persist when we face adversity alongside our clients. For me, on this end of May day in Manitoba, I found just enough time between the rain and hail to plant my tree, but came prepared for whatever weather was coming my way. Coming back to the branches, I'll first speak to those that symbolize values and ethics. These competencies have been a consistent factor throughout my MSW journey, just as they have in my practice. When considering values and ethics in the context of my palliative patient, I recall various considerations, particularly surrounding respect for inherent dignity and worth of all persons, particularly surrounding self-determination. In order to uphold such values, my focus involved effectively communicating the patient's options, which was a challenge due to some suspected limitations in cognition, alongside processing the difficult reality he was facing. As mentioned, repetition in an empowering, informative tone was essential, as well as collaboration with the patient's son and other interdisciplinary team members to ensure consistent messaging without bias. Through this process, I was fostering my patient's right to choose based on informed consent. Though the family present in this case were supportive and unbiased, I recognize that other end-of-life scenarios can involve complex family dynamics, which requires validating the diverse feelings of others while ultimately advocating for the patient and creating an environment where they feel supported in their self-determined choice. The pursuit of social justice is part of our profession's core, so it is important to acknowledge the challenges in maintaining this value. In this case, we faced macro-level barriers that impeded my patient from receiving access to resources to meet his needs. Shared Health is Manitoba's provincial health directive, which has centralized health services over the last 5 years. Brandon Regional Health Centre is considered more of a rural hospital located in Brandon, Manitoba. Thus, many specialized clinicians have been centralized to Winnipeg hospitals. Though I fostered self-determination, these systemic implications hindered my patient from having true freedom of choice, as we did not have realistic access to a surgeon locally who could have performed his surgery, counting this out as an option before it was even really on the table. This situation, along with the knowledge gained from my studies in health policy, both assert the need for social workers to be active participants in policy development, to advocate for implications that uphold our values and, moreover, human rights, protecting the vulnerable like my patient and those that are vulnerable as a result of homelessness, addiction, and disability. Now that I've highlighted experiences symbolized by leaves attached to the values and ethics branch, I will now move to another branch involving the competency of critical thinking in professional practice. A framework supporting me in becoming more of a critical thinker is the social determinants of health model, which asserts the relationship between social structures, oppression, intersectionality, and health outcomes. I've personally found adopting this framework has helped me bridge connections between comorbidities and various determinants, enhancing my ability to support more sustainable solutions that complement traditional medical interventions. It has also helped me to consistently expand my thinking beyond the individual patient to environmental impacts and higher level impacts, such as upstream effects related to determinants including race, Aboriginal status, culture, sex, gender, age, socioeconomic status, disability, and more. It has caused me to recognize the true responsibility of environment, which helps me better support patients and clients, in part by guiding them to understand the limitations their environments pose on their individual choices, empowering them to work from a perspective reducing internalized stigma. My palliative care patient was a white male in his 80s who was living on his farm. He was able-bodied aside from general aging effects of his aneurysm slowing him down, but he attended regular appointments with his doctor, had consistent access to transportation, and was able to independently drive. He also had a close network of family supports with no personal history of addiction disclosed or mental health issues. If any of these determinants were different, the situation could become more complex. For example, if his level of cognition and independence was compromised due to other disabilities, perhaps his capacity to make his end-of-life decisions would have been more at question. If he was struggling with addiction, maybe he would have chose to leave hospital to fulfill his needs, or if he was homeless, the physical palliative care environment and associated rules and practices may not have aligned with his end-of-life wishes. I also think about the differences in outcome if he had specific cultural practices for end of life care that were not supported in our westernized hospital environment. One of the social determinants of health I want to focus on is if my patient had Aboriginal status. What could have looked different with his care across his lifespan? This will take us to another branch focused on the competency that encompasses promoting human rights and social justice. As we focus on Aboriginal status, this was a critical determinant in the case of Brian Sinclair, who holds a spot on another leaf as a significant practicum learning experience. Brian Sinclair was an Indigenous man who presented at the Health Sciences Center Emergency Department in Winnipeg with symptoms that were dismissed as intoxication but were actually related to an internal infection. After 34 hours in the waiting room with no further follow-up, Sinclair died of a treatable infection. Sinclair was also homeless, a double-leg amputee due to frostbite from being unhoused, and struggled with drinking. All social determinants that impacted his overall health and, unfortunately, his care. Without my course learning and ER practicum experience, I don't think I would have been able to understand the interconnectedness between the diverse determinants patients like Brian Sinclair face and their true effects. Such a close-to-home, fairly recent tragedy really grounded the continued reality that systemic racism and oppression not only prevail, but can be lethal. During the first course of our program, one of our instructors highlighted that oppression is the air we breathe. It is situations like Brian Sinclair's that reaffirm it really is everywhere, in ideology, policy, services, practice, assumptions, interactions. Our continued governance under systems developed with colonial values imposes inequities for Indigenous people and barriers to service providers attempting to promote human rights and social justice. This year, I had the opportunity to truly analyze the calls to action established in the Truth and Reconciliation Commission's final report during an ethics course, which created a better foundation for translation of the calls more concretely into my practice. I recall discussing implications of Indigenous patients with other interdisciplinary team members and referring to local community resources as well as the hospital's spiritual care provider, who is an Indigenous woman, for various support, all with intent to promote social justice by reducing bias, prejudice, and racism from emergency services through anti-oppressive practice, preventing further tragedies like Brian Sinclair's driven by systemic oppression. The final branch represents the competency surrounding the importance of research engagement. My advanced research course definitely grew some leaves. I chose to focus my research proposal and literature review on exploring implementation strategies to reduce oppression of Indigenous peoples across health services. What I learned from this experience was the effort required in academically exploring appropriate, individualized approaches for diverse groups of Indigenous people accessing health services. This really means more funding and support need to be allocated to such causes, including action-based research, in order to address the effects of colonialism, moving beyond the identification of issues and the end goals into implementing research-based action steps to actually get there, upholding many calls to action from the TRC in the process. Overall, my learning throughout the MSW program has given me tools to critically analyze, think, and effectively ask questions and advocate for my patients and clients, especially those a part of marginalized communities, as well as my colleagues and myself. Even when I don't have fancy tools like I had to plant my tree, I've expanded my knowledge and capabilities to draw from resources which include adapting to the unexpected needs of changing situations. What I appreciate about the symbolism of the tree is that everything is connected. More leaves will flourish simultaneously with my professional experiences. This tree will grow for a very long time, as I hope I will. It is physically in a place where I can revisit it here in the forest on my family farm in LaSalle, Manitoba.
And so for now, I hope to continue my employment with Veterans Affairs Canada while I work towards my ultimate goal of enlisting with the Canadian Armed Forces as a social work officer. This position will require further training to enhance my clinical skills specific to the military population. Completion of the MSW program is my final requirement in the recruiting process to qualify for my desired position. The program has been both beneficial in my professional journey in the social work field as well as my personal life. I look forward to applying my knowledge in future roles to come and continuing my learning as I move forward. Thank you for watching and take good care.